Hi, everybody. I just want to say welcome to our first of a three-part webinar series with Dr. Mark Tyndall, Vaping Behind the Smoke and Fears. So the team here at Rights for Vapors, we've partnered up with the Canadian Vaping Association, the CVA, to bring an exclusive three-part webinar series featuring Dr. Tyndall, who's the author of Vaping Behind the Smoke and Fears. If you haven't bought this book, I'm going to highly recommend that you buy the book. I will put the Amazon link in the Q&A. This is the first of three sessions. Dr. Tyndall will share his journey from infectious disease specialist to one of the most respected voices in evidence-based vaping research and advocacy, but also one of the most respected voices when it comes to harm reduction in this country. He will explore the science, the controversy, and how real-world experience shaped his perspective on harm reduction and safer nicotine. I want you also to meet your moderator, or our moderator for this evening, Professor David Sweaner. He's widely recognized as an expert in tobacco control and public health policy. David is a longtime advocate for evidence-based approaches, especially for tobacco harm reduction. He has advised governments and organizations across Canada and the world and brings his incisive, thoughtful approach to complex debates. And it's quite fun listening to him debate. So a few little housekeeping rules. Your microphones are on mute. We do have a Q&A feature. So at the top, there's a Q&A. You can ask your questions as you go. If you are having any technical issues, please email us at maria@rightsforvapors.com. We will get that all sorted out. And up first, obviously, I think that's it. And I'll also put the link for Dr. Tyndall's book in there. But now, I don't want to waste any more time. We'll get right into Dr. Tyndall's presentation.
Okay, great. Thank you very much, Maria. It's a pleasure to be here. Just to put a little thing in context, just to make everybody feel a bit at ease, this has been my afternoon, so I knew I had this thing at 4 o'clock. I had an appointment in the downtown east side with some of my colleagues that I used to work with, and a few things happened there unexpectedly, so I was a bit delayed coming back, and then there was a lot of traffic, and I got home to do this webinar about 10 to 4, so I still had some time. And I put it up my computer and it wouldn't work. So I tried everything. Maria and Ash were trying to help me figure it out. It just wouldn't work. So then I got my laptop up, and that's what I'm using right now, but I don't have my slides on my laptop, and somehow I can't get them over. So anyways, I'm going to do this without slides, but I think that'll work out fine. So that's my hectic day, and it seems to be all self-imposed chaos. But I'm really happy to be here, and I really thank Maria and Rights for Vapors, and also Sam Tam and the CVA, Canadian Vaping Association, to help put this together. I really appreciate it. It's helpful to promote my book and my work, and I've really enjoyed my association with both of these organizations, and again, thank you for making this happen. So what I bring to this debate is a background in harm reduction, and I'm not a career tobacco control person, as many people who speak on this topic are, who have spent decades in tobacco control, and including David Sweaner, who's I'll be talking to in a few minutes. So I come to this in a totally different from a different place, and it's from decades of working in harm reduction. And one story that I like to tell that kind of encapsulates it. I was working in Ottawa in 2011, and I was conducting a large cohort study on people who had HIV and were using injection drugs. And we were following a large group of people over time and looking for outcomes. And most of them were bad outcomes. So drug overdoses and new HIV infections and people who couldn't stay on their HIV medications and things to try to ultimately improve the situation for people who are using drugs and HIV. But as I was analyzing the data, it occurred to me that most of the bad outcomes were smoking related. So people were developing severe COPD and had heart attacks and a few new lung cancer diagnoses. And HIV wasn't playing much of a role in the bad health outcomes that we're following. And it also occurred to me that pretty much everybody in this cohort were smokers. And many were quite heavy smokers over long periods of time. And I remember people in Ottawa, most of them were not buying commercial cigarettes anymore in my cohort, but just buying bags of loose tobacco and rolling their own. And we really weren't offering them anything. And in 2011, I first heard about vaping and thought this was an ideal solution for people who I was working with. And I introduced it to some people in the cohort, and they really liked it, and it sort of caught on. And if you had told me, 12 or 14 years later that we'd still be having trouble getting the message across that this is a really groundbreaking technology for people who are using cigarettes, I never would have believed it. I thought that we would have been able to put policies and education in place that would have had most people vaping or using alternative nicotine products by now. But we're probably worse off now in 2025 than we were in 2011. And so I've been focusing on this now for over a decade, and still, each year that goes by, I'm more and more convinced that we really should see the end of combustible tobacco, and it's just not happening, which is very frustrating. And I see my role now as trying to make people understand that other harm reduction interventions that have worked in the past, if you believe in them, then you have to support vaping. And as I said, I was downtown today having lunch with a couple of my colleagues who I worked with for years in HIV, and it's still a hard sell to get them to understand that they owe it to their patients that they're seeing that they offer them an alternative to smoking. And it's so obvious to me, and it's still a hard sell to some of my colleagues. Other harm reduction things that I've been involved in the 1990s, I worked in Kenya, where condoms were basically our only harm reduction intervention. And I've been quite involved in needle exchange programs here in Vancouver to prevent HIV transmission, supervised injection sites, and most recently safe supply programs where I was promoting giving people safer opioids and to save their lives from instead of buying street fentanyl, which it continues to kill a lot of people. So the concept of harm reduction to me is crystal clear, and why we can't get the point across to people that this new technology can really eliminate combustible cigarettes in Canada and globally if we set our minds to it. So it's extremely frustrating. One thing that one other part of harm reduction that I focused on was kind of the structural impediments to finding solutions to this. So you can term it as structural violence, basically. So as far as cigarettes, we've set up situations for people that we've made a society statement that's very hostile and violent towards people who smoke cigarettes, and we put people in really bad situations, and we've decided that it's okay to put nasty, grotesque pictures of people dying of smoking-related causes on cigarette packages. In Canada, recently, we've decided that it would be a good idea to put disparaging comments on each cigarette, like cigarettes causes cancer and things that basically just further stigmatize and shame people. And I've known for all my work and people who are using harder drugs that shaming and punishment and isolating people is probably the worst thing that we can do to encourage people to change their behaviors or come up with something new. And cigarettes in our society, at least in Canada, it's really we've really worked hard on stigmatizing cigarettes and the people that use them. We've vilified tobacco companies for for all the harm that they have caused, but we've decided that anything that comes out of a tobacco companies is bad, and that we need to we stop using it and stop supporting that, which includes vaping and safer nicotine products. So we've created situations in Canada and globally in many other countries that have really caused a lot of stigma and harm to people. And when vaping came along, we've focused a lot on youth, and again, kind of taken an approach that we want to scare and confuse young people about the risks of vaping. And we've come up with programs and campaigns that really mock people who are vaping, make them look foolish, and that they're and make up stories about how damaging it is to their health. And we know that young people are too smart to accept all that, and a lot of these campaigns have totally backfired. And instead of focusing on things we know can work with education, giving young people the facts about vaping, understanding that young people will try different things, different substances, and vaping is just part of a long list of what we think of risky behaviors that youth will try. But again, we've got it totally upside down the way we're trying to scare people about this. One quick comment on youth, because that's really one of the key impediments to seeing vaping policies change, is that the vaping among youth in Canada actually peaked about 2017, and every year since then it's gone down. It was a fad, kind of a social media explosion, but that's all sort of died down, and there's a small but steady number of kids who still vape, and they were likely the same kids who probably would have smoked cigarettes. And so in that way, we're winning, and certainly it's very encouraging that cigarette smoking among youth is at an all-time low. Having said that, that is what keeps tobacco control and abstinence-based people going, saying that we're making progress. You see what we've been able to accomplish with new starts in tobacco, but they fail to recognize that there's 3.5 million Canadians who still smoke cigarettes. And as a public health physician, I think it's rather unethical to say that we've won the battle when 3.5 million people could still die of smoking, and that's going to take many, many years and decades to clear out. So if we think, we're going to reach some time when smoking is very low in our society, I think that would come, but at the expense of letting all current smokers die of smoking-related diseases. And I think that's entirely unnecessary when we have alternatives for them. So that's my comment on youth. I have a whole chapter in my book about youth and how we've allowed moral panic to overtake our the science, and that if you ask parents of teenage kids, they're now thinking that vaping is the biggest threat to their kids, and that wouldn't probably make the top 25 things that are at risk to their kids right now. So we've allowed tobacco control people to overstate the dangers of vaping among youth, and that's really clouded the issue. The other main issue that's clouding things is the role of tobacco companies, and it's very tricky because clearly we understand that manufacturers of cigarettes over decades have been very deceptive with their messaging, and that they've profited greatly of the sale of a deadly product. And as they kind of transition, it's very difficult for public health and governments to accept that we now have to work with tobacco companies to get them to transition. But if we're ever going to do this in any kind of urgent fashion, then the only way is to make policies that promote and encourage companies to stop manufacturing cigarettes and get on with alternative nicotine products. And that's, again, that sort of discussion is very difficult when tobacco companies carry so much baggage. So I wanted to, in this time, kind of stick to things I talked about in my book, and a lot is there that I'll cover over these three symposiums. But what I wanted to talk about today was mostly how I came to this, how I feel as a physician and public health doctor that it's my ethical responsibility to promote safer products, and that we shouldn't let people die unnecessarily of some totally preventable thing. I used an analogy with my doctor friends today at lunch. So if they had a patient who came in with high blood pressure, they would tell them that high blood pressure is bad for their health, that can lead to strokes and heart attacks and kidney disease and so many other bad outcomes. And if all they did was tell them that they should get their blood pressure down and come back next year, and year after year, the same scenario, that all they did is tell their patient that really you need to exercise more, lose weight, eat less salt, whatever you think will lower your blood pressure, but please get it down. And then 20 years in, they die of a stroke. You'd be held for malpractice because you had something that you could have offered them, antihypertensive medications that would have prevented that outcome. And I think it's the same with people who come in year after year and are smoking cigarettes, and their doctor just tells them, you really need to stop smoking cigarettes, and year after year goes by and they don't, and then they have a bad health outcome. I think there's some malpractice there if you never attempted to offer them any safer product. And I think we need to, get the message out there that people who smoke deserve the best treatment and care that we can offer them. And at this point in time, that would be vaping. And so I need to get the message out to my colleagues about that. So maybe I'll stop there. I apologize again. I had some beautiful slides, but I'll show them next time. And then I really welcome the discussion with David Sweener, who's taught me a lot about tobacco control, and we'll have a discussion, and then we'll open it up to questions. Thanks.
Okay, Mark, we'll need you to keep your microphone on mute when someone else talks. Perfect. David, do you want to jump in?
Sure. And is the system such that I should also put it on mute when I'm not yapping?
No, it's just
okay. All right. Mark's the one causing the problem here, I guess. Yeah. You've got a long history of that, Mark. I was actually going back to thinking about when I first met you, which is when you were in Ottawa, and you were at Ottawa General Hospital. And I was reading about work that you were doing on harm reduction with illicit drugs. And you had said some things. I thought, this guy understands harm reduction. And I thought maybe I can go chat with him and use my powers of persuasion to convince him that nicotine is something that he might also want to pay attention to. And my powers of persuasion were such that I persuaded you long before I ever met you, because I went into to your office and you just totally got this issue. And that's not surprising in retrospect, given your history of dealing with so many other issues. One of the other things we have in common is experience in East Africa during the peak of the AIDS crisis. I was just there on short trips on public health missions, but you were living there, and there's parallels that you point out in your book, and I think that's important when we look at vaping, when we look at nicotine, to know that this isn't somehow magically different than any other issue that you've ever faced. So when you were dealing with issues like HIV/AIDS, what was the role of what we might call moralism of, we can see a solution, like in this case, things like condoms. We can see how easily that this could be implemented. We can see the tremendous impact it could have, and yet people try to prevent it from happening. Because I think this is very, yeah, go ahead, because you were experiencing it. I saw it when I was there.
Yeah, so I arrived in Africa in 1990 or end of 1989, and at that time, HIV. We knew the virus, what caused HIV by then, but there was no treatment available. And that there was beginning of treatment available in Canada, like AZT and DDT, DDI, but it wasn't that effective, and there was absolutely nothing happening in Africa. And so the only thing that I could do when I worked in these clinics was offer people some condoms and some education, and it was when I look back, it's unbelievable how much pushback there was to condoms. So the church was very adamant that we should not be offering condoms to people, mostly again because of kids. What if kids got a hold of a condom and then they start having sex? Um, and yeah, just a moralistic reason. The government bought into this. So there were days at the clinic that I was working at where we didn't have any condoms. And I remember sending people out to different stores around before the clinic started, just to say, find out if this store still had some or that place still had some. So at least when I saw somebody, I could tell them, we'll go to that store there and I think you can buy some condoms. But there was times when we didn't have any condoms, and there was a lot of discussion in the papers then. And it cost, I don't know, that went on for years, and it cost, literally probably millions of lives in sub-Saharan Africa because we didn't, because the government was not willing to promote condoms. And much like vaping in youth in Canada, like it's all because of what message are we giving to the kids, and so there is some real parallels. And when I've made a chart of like the parallels between smoking and HIV, and although HIV, people think of it as, a death sentence, it's kind of like cigarettes. It takes decades before somebody dies of HIV on average. It's a slow, painful decline in people's lives, and to me, not offering vaping to people is sort of like not offering them HIV treatment, because we'd rather tell them, well, just don't get it. And I'm sorry if you have it now, but you're on your own. So there is some parallels, and it's scary to think that in the 1990s in Africa, condoms were suppressed.
Yeah,
I lived it. I remember being given a tour
of the major hospital in Kampala at the time, and being asked beforehand, because I was the non-doctor in the group, that have you seen people dying from HIV/AIDS? Have you seen people dying from lung cancer, which they also had there because they'd had smoking long enough? And before I could say no, I actually went into law school because I don't like hospitals. He said, well, you better prepare yourself because we don't have painkillers here. And then to see what was going on in those wards, and then to contrast that to the people, as you're talking, who are trying to prevent condoms from being available, and then going into a market in Kampala and talking to young men about condoms. And they knew that condoms could reduce their risk of disease. But the free condoms weren't available because of policy, and they couldn't afford to buy them on private markets. And you're just watching this tragedy unfold, and there's, that want to pull your hair out reaction to say, have these people any idea of the harm that they are causing? while thinking that they're being righteous. And then that moved on to things like studying what was happening with illicit drugs in Canada and efforts to try to have things like safe injection sites. And again, there you were in the forefront of things like Insight in Vancouver, a safe injection site. And again, battling against the people you would ordinarily think should be your allies, as I recall. And maybe you can give some background of what that was like and fighting it right through to the Supreme Court of Canada in order to get the right to life, the right to have access to a safer product.
That's another great example. So Insight in Vancouver opened in 2003 after about 2 years of really trying to get it planned. It was really the Portland Hotel Society and community groups who really pushed this to the forefront. And it was just so obvious that, injecting by yourself in your room was where people were dying, and that we needed a place where there was support and some cleanliness and some help. So there was little illegal things popping up all over, but the money became available to make quite a nice clinic. There was 12 stalls or tables where people could come in, and it was well staffed. And the Conservative government at that time was dead set against it, but somehow was pushed to allow a 3-year evaluation of the pilot project, and it was highly successful. And I was involved in many studies and publications around this. There's like 45 or 50 publications directly around Insight, all of them showing positive results, basically. So we had extremely strong evidence. And then at the end of the 3-year pilot, the government was very intent on closing it down. And it took, another 4 or 5 years before it worked its way through the court systems. And the Supreme Court of Canada ultimately judged 9-0 that you have to keep this thing open. Your moral distaste for drugs cannot trump the causing death to people who are using these drugs. And so it was so clear that Insight would save people's lives and connect them to care. But the sad story about that is the moralism still perpetuated. So although Insight was allowed to survive, it wasn't until the fentanyl crisis, like starting in 2016, 2017, that more than Insight opened up in BC. So it was still, for years, we knew that how successful supervised injection sites were, but in no other communities. There's only one in the downtown east side. They could have used 6 or 8, and no surrounding communities with drug use had any supervised injection sites until 2016. So again, all based on just not in my backyard, moralism. It's people's choice. If they want to die, they want to kill themselves using drugs, so be it. And that's our attitude with cigarettes. People want to smoke cigarettes and kill themselves, go ahead. That's kind of basically the attitude. You just don't really care. I mean, if it's your family member that's dying, you may have a little more empathy towards it. But as a society, I don't think that we do. And I think that's really allowed the opening of all this anti-vaping stuff to happen at the government level. It's really a political win for many politicians when you say you're protecting the youth. And that people who smoke cigarettes, why should we get them a safer product anyways? They should just stop if they're that concerned. So that's kind of that moralistic part of it is still very alive in Canada, and our attitudes towards any substance use.
Something that's going on for a very long time. I mean, the moralistic opposition to coffee was extraordinary when coffee was a relatively new product. And at least if you're caught vaping, you're not whipped, and on a second offense, you're not tied into a sack and thrown into the Bofors. But that used to happen to coffee drinkers, along with a whole lot of other terrible things, because of course it was completely immoral to be consuming something like coffee. And Frederick the Great was very concerned that coffee was going to replace another product, just like some people are concerned about vaping replacing cigarettes. He was concerned people drink coffee instead of beer, and you sure don't want that to happen. So the moralism has been with us for a very long time. We experienced it again with alcohol prohibition, which you also talk about in your book. I mean, I think one of the great examples when you talk about this lack of humanism, this lack of meeting people where they are, understanding their lived experience, was the way people would cheat to try to get around U.S. prohibition rules. And if you could come up with a beverage that was shown to be non-palatable when tested by the government, but could become palatable over time, like by the time it got to drinkers, you could do well. And people did come up with something for a Jamaican ginger drink known as Jamaican Jake, which you may know the history of it, but I think it's just such a great example of how crazy this gets. What they added to it, plasticizer, happened to be a neurotoxin. And as a result, and they ended up with a cheap alcoholic drink that was consumed by low-income people, particularly blacks and very low-income whites. And thousands of people ended up being paralyzed or dying as a result of this. But the reaction of many of the pro-prohibitionist people is fantastic, because if alcohol kills people, then if it kills them rapidly, or it causes them to become paralyzed and they walk funny, we'll get more people to quit drinking. And that strikes me as similar to what we're dealing with on cigarette smoking. That, well, great, if it's killing people, then it's easier to force people to essentially quit sinning, because if they could do what they're wanting to do without it causing them harm, how do we convince them not to do it? And the same with, I mean, God, if they start using nicotine pouches, if they start using vaping, and it's not causing them any significant harm, how on earth can we force them to stop doing what they're doing? But where do you think that moralism comes from? I mean, you've dealt with it all your life. And how do you think we can counter it? Because there's some evidence of success on that in some areas of illicit drugs, but where does it come from? What can we do about it other than, again, yank out our hair?
Yeah, I mean, I don't know is the question. I mean, there's a lot of people that I know and that I've, come to work with who get it with other drugs, looking at, cigarettes are a little bit tricky because of how widespread they are and how many people use them and what kinds of people use cigarettes. But for the most part, without being too generalizing or stigmatizing, I mean, it's really certain groups have much more smoking than other groups, and with drug users, sure, people who I've dealt with heroin use or fentanyl use, sure, it crosses a broad spectrum of our society, but most people have a story to tell behind their drug use. And if you learn about it and talk to people, you can't help but have some kind of empathy or understanding of why they're doing what they're doing. And that kind of, try to get out of the moralism and the judgment, I think, is really important. And I think there's many examples in society where people have gotten over that. I think mental health in general, Canada's made some progress in how we look at people with mental illnesses now, but it's really a different way to look at the people in a more empathetic way and try to understand where they're coming from. And in cigarettes, there's certainly populations that are much more impacted by this disproportionately, and you have to understand how that happened. And cigarettes are generational for the most part, and that it's, you have to understand, if both your parents smoked and you're surrounded by smokers your whole life, then it's a very good chance you're going to be a smoker. And to understand how that happens, and try and put your feet in their shoes is a really important thing to do in all my medical career, in all my medical practices. And so, but getting that across is very difficult, and keep calling people on what appears to be hypocrisy and trying to blame the victim for all their problems rather than looking at the situation that they find themselves in, I think is important. And that just reminds me of, how we approach this with youth, and somehow this has become a huge issue for youth. Well, it's just the opposite. Vaping should be a way that we want to it should be very helpful. It prevents secondhand smoke for your kids if we can get their parents to stop. It prevents premature death for your parents, which is quite traumatic for kids, for sure. And so I think it is a youth issue, but it's not what we think. So if you have parents who smoke and they switch to a safer product, that's a pretty good message to your kids, that they care about their health, and their kids are much less likely to smoke. So there's many reasons that we have focused on youth, but I think we have it up totally backwards. Like the reason we should be really keen on getting rid of combustible cigarettes is really a youth issue also. And the best way to do that right now is to get people on safer nicotine.
Yeah, I totally agree on the issue of youth. I think the situation that we're in is we live in an age where, maybe more than most times in history, people use slogans in place of reason and discussion. The "Make America Great Again," "Get Brexit Done" sort of thing. And screaming youth, as has happened on so many other issues. You get it on illicit drugs. I mean, we've had it in the history of homosexuality. I mean, I'm saying this from my hometown, that when I was in university, there was a column in our local newspaper about how we had to protect the town from homosexuals, because homosexuals abuse children. That's what they do. And how do you spot homosexuals in order to try to prevent them from getting into our town? Which I thought was absolutely hilarious, except, showing it to gay friends who said, no, that's not funny. People really believe that sort of nonsense. And in this case, to say, if you're actually interested in youth, you would have to say, how do you weigh, the potential of a young person using a vaping product compared to the number of adults who would be able to quit smoking with these products? And what's your trade-off? Are you saying 20 adult deaths for one young person not using? But beyond that, to say, even for the young people, what's the cost to them of having a parent or a grandparent become incapacitated or die, or a coach or a teacher, other significant adults? That's a real serious cost. And when those people are dying because they couldn't get something that would get them off cigarettes, that's really significant. And as you say, their exposure to secondhand smoke, the risk of household fires, even the reduction in disposable income for the necessities in life within their family if their parents are having to buy cigarettes. And then, of course, all the young people who would have taken up smoking had it not been for vaping. So if you do any sort of rational risk-benefit analysis, you would say, my gosh, I mean, this could unfold the way we've seen it in Norway and Sweden and elsewhere, where young people just quit smoking because they've got an alternative that they can go to. The health implications are huge, especially as time goes on and that cohort ages. But we're also seeing this big reduction among adults. But that also gets into this that view of, well, we're just going to get everybody to quit. We're going to have a nicotine-free world, which is now becoming another slogan that's used and makes, in my view, no more sense. You write in your book about why people are smoking, but I think it goes broader in your experience about why do people use drugs? Why do people? I mean, thinking of the book Gene Heyman wrote called "Addiction: A Disorder of Choice," where he says the general thesis is one of the hallmarks of consciousness is that we seek to alter it, and we will alter our consciousness in ways that we find beneficial. So whether that's things like having a coffee to get going in the morning, or to increase your ability to do endurance exercise, or having a glass of wine to relax and become more social, watching a sunrise, taking up jogging, there's lots of things we do to alter our consciousness. And in some cases, it's as I think Gabor Mate has written about the downtown east side that you know so well, that you never meet a young woman IV drug user who wasn't abused as a child. They're seeking oblivion. But what's your experience on what people are doing and the idea that we're just going to somehow have a nicotine-free and an overall drug-free society? Why are people doing what they're doing?
Yeah, well, yeah, I mean, nicotine, if you look at the history of nicotine, which I'm sure you have, like people have, whether it's you used 2,000 years ago or 6,000 years ago, I mean, it's been with us forever. So how anybody thinks it's a rational approach to say we're going to eliminate nicotine, it makes absolutely no sense, and eliminate all these drugs. And, I think part of the how I have to try and catch myself when I'm talking to media or at conferences or things that I actually believe that nicotine has a very positive role for people, and we're getting into kind of recreational nicotine versus getting people an alternative who smoke cigarettes and are already dependent on nicotine. But I mean, if you look at all that's available around nicotine, man, there's good reasons why people are using it, and it's I try and explain it to people like it's like caffeine, or but it definitely has its benefits for people. And I think I was brought up in this anti-smoking world to think that the only purpose of nicotine is to addict people to cigarettes, and it's far beyond that. And people get a benefit out of their use of cigarettes or nicotine, or however they get their nicotine. And I think it's quite clear with access to pouches especially, and somewhat vaping, that more and more people who have never used nicotine before are discovering that it can be quite helpful for them or useful for them. And we're going to have to deal with that. So I think over time, nicotine will become no less prevalent in our society, maybe a little more prevalent, because people can use it without dying of cigarette smoking. So like all drugs, it's a quite a mild drug compared to heroin, cocaine, and crystal meth and other drugs that I've dealt with as far as psychoactive drugs. But it's definitely got its benefits for people, and people enjoy it. And there's probably many therapeutic uses for nicotine. So it's a tricky subject when I'm basing my premise on we have to get rid of combustible cigarettes, then to kind of go, well, it could be a useful product for people, and then you sound like a nicotine salesman or something. So but I'm quite aware of everything I know about nicotine now, that there are some major, pretty significant benefits to people, and people are gonna keep using it. And the reason I never noticed cigarettes as much when I was dealing with other drug use is that really cigarettes were part of harm reduction, even though they're killing. But if you're wired to heroin, the first thing you do in the morning is get up and have 2 or 3 cigarettes before you go and hustle for your heroin. And if you don't have a cigarette or didn't get your nicotine, you'd have to be out there a half hour earlier probably. So it and did calm down people, and people who were struggling with their addiction use cigarettes to kind of hold them over before they got something else. So in some ways they were, the nicotine was very valuable to people to kind of smooth out their day. And if they can get that nicotine in other ways, then I think it'd still be very, very useful to them. For people who are uncomfortable with the whole idea of nicotine addiction and nicotine use, I think the other benefit of vaping is that people can have a much better chance of weaning themselves off nicotine if that's what they want to do. So it's much more difficult to know how much nicotine you're getting with cigarettes, but you can dial it right down if you want to with vaping. And a lot of people who are committed to getting rid of nicotine altogether can do it much easier with vaping. But people may find that they still want to use it sometimes, and yeah, so I think as a health problem, I think it's just much inconvenience. If you have to stick a pouch in your mouth every hour, then it's a bit inconvenient. But as far as health effects, long or short term, I think there's really not much to worry about.
Brought back another memory about a quarter of a century ago. I was in Paris for international conference on nicotine with nicotine researchers. And one of the sessions that they had, which was aimed at young researchers, is they had 5 of the world's leading experts on nicotine. These are preeminent researchers. You probably recognize all their names. Put them on the stage and just said, if anybody's got any questions, ask them. Here they are. And this is just such a wonderful way to pick the brains of the leading authorities on this. And afterwards, I was walking with one of them back through Paris, and I said, there's one question I was thinking I should have asked, but I didn't feel it appropriate. And he was very, very dignified and saying, "Oh, I'm so sorry." And what was the question you were going to ask? And I said, "Well, I was going to say, Professor, what's that you've got in your mouth there?" And he was using nicotine. And he said, "Well, of course I had some snus in my mouth. It helps me focus. But truth be told, 4 out of the 5 of us were using nicotine, while we were on the stage talking about nicotine." And one of the things I subsequently learned is that so many of the people I know who are most knowledgeable about nicotine started using nicotine. They're saying, I'm getting older. I think this will actually help me. It can reduce my risk of certain conditions. It can help me focus. It might help my memory. As long as I'm getting it in a very safe form, there's really no downside. And that gets into issues of understanding why people are using a drug. And again, going back to the Gene Heyman, we're seeking to alter our consciousness. We generally keep talking about nicotine as being addictive, and people are using it because they're addicted. But I had a researcher, again, years ago, probably the most knowledgeable person I ever knew on nicotine issues, saying what you keep getting wrong is thinking that it's only addiction. And any psychoactive substance, whether it's coffee or heroin, there's different reasons people use it. Some people are using it for, essentially just social reasons, like, hey, Mark, haven't seen you in a long time. Let's pop in for a coffee and get caught up. That's social. Or given the jet lag that we have flying over here to this meeting in Athens, I think we better get a coffee before we stand up to speak. I mean, that's self-medication. Oh man, I'm not going to get rid of the headache until I get a strong cup of coffee this morning. That gets more into the area of addiction. But in your book, you talk about some of the mental health conditions that are associated with very high rates of smoking. And how much of that do you think can be ascribed to self-medication? I mean, and again, I had somebody tell me years ago, if you had a magic wand that eliminated nicotine addiction, and I put you in a room full of people with schizophrenia, and you could wave that wand, and they were no longer addicted to nicotine, do you think they'd smoke any less? And the point being, they're not smoking because they're addicted. They're smoking because of the effect that nicotine has in dealing with their condition. But you've lived this with other drugs. How much of it is self-medication?
Certainly, I think there's good literature about schizophrenia. So, I mean, if you look at any graph of smoking in schizophrenics, it's like 80%. And that, as you see graphs across the country, that's why it's a little deceptive in Canada when you talk to tobacco control people who say we're doing a pretty good job, because every year it drops by about 1%. But if you look at schizophrenics or you stratify by different conditions, it's like a straight line. Like there hasn't, since the 1960s, smoking among people with schizophrenia hasn't really changed. And I think, I use examples in my book how cruel and unusual the punishment is to have like psychiatric hospitals that try to deal with people with schizophrenia, and the first thing they're told that they can't smoke cigarettes is pretty horrible. And that's why a lot of people don't stay, and a lot of people don't go in the first place, because they wouldn't mind better treatment for the schizophrenia, but they're sure as hell not going to stop smoking cigarettes. So and it's shown that it helps with the if people are on psychoactive medication along with nicotine, the medications work better. And I think people realize that, and the medications are tolerated much better. And I think people realize that. And if you're schizophrenic, not having cigarettes makes things worse for you. So I think there's lots of clinical evidence that probably because of pharmacological impacts of nicotine, it's really useful for people with schizophrenia. And I think it's not as strong evidence with other mental health conditions, but I think because there's a disproportionate number of people with diagnoses of bipolar and depression and schizophrenia that smoke more, I think it's pretty self-evident that people choose to smoke because they feel it's helpful to them. So I think as a therapy, it's probably good. I mean, I think that, I understand that, psychiatric hospitals are concerned about secondhand smoke and then fires and all these kind of liability issues, which are real. But I can't, I've been talking to people in psychiatric hospitals forever, give people vapes. Like it's, sticking a patch on, we know is not the same thing. It will not work. And that's what they think they're doing. Oh, what do you mean we give them a patch? Well, the only thing we know about patches is they don't work very well. And, so in these conditions, I think, and then other people who are using other drugs, as I indicated earlier, are heavy smokers, and I think other addictions also are probably smoothed over and helped by nicotine and smoking and the social part of smoking. I do say, and I have a part of my book, a story when they made the HIV ward at St. Paul's Hospital non-smoking, and what a terrible impact it had on the whole ward. Like it was people left because they couldn't smoke. People weren't admitted, wouldn't come in to get their HIV treated because they couldn't smoke. And then the social impact of people now had to stay in their rooms because the smoking lounge was closed down, and it had a huge negative impact on people, and all because secondhand smoke and cigarettes kill people. And now we have a new option. So all that doesn't matter. It shouldn't matter anymore. Like people should be allowed to get nicotine. We give them all kinds of other drugs that are way worse than nicotine and prescribe them to them. And people would really, their whole hospital experience would be much better if they had nicotine. And we should, be giving that to them.
Yeah, I mean,
thinking basic concepts like
the Enlightenment, the importance of science, reason, and humanism, like actually caring about people. And I think one of the issues related to this, because you talked about the number of cigarette smokers there are in Canada, and we hear this number very regularly. Generally, the number comes from surveys. And one of the things we know about the people who are most likely to be smoking, like when you mentioned the very high rates of smoking among people with schizophrenia, they're the people also least likely to answer surveys. And I'm reminded of Abraham Maslow in Philosophy of Science saying, scientists are very good at measuring the things they know how to measure, but they're equally good at ignoring the things they don't know how to measure. And we don't know how to measure what's happening in a lot of our really disadvantaged communities. I mean, we could do a phone survey, I'm sure, or even an online survey to find out if any Canadians are homeless, and probably find none are. Because, of course, the people who are homeless aren't, on their computer screens. The problem we have is that, once you don't measure something, if you don't see it in your measurement, you ignore it. And we know from our surveys, this is something I've done much of my career. When we get a survey on smoking, look at the total number of self-reported smokers. Look at the average number of cigarettes per day they claim they smoke. Multiply those together and compare it to the total number of cigarettes being sold in a year. And you find that a huge percentage of our cigarettes are just unaccounted for. So we know the consumption is that much greater, but I think this gets, further into what we were discussing earlier about the moralism, the idea that these are expendable people. We're not measuring them. We don't really care. Like we know, if we think about it, they're out there in huge numbers. And some of what we're doing is inhumane. You mentioned in your book how much money someone with schizophrenia will be spending buying cigarettes, and what a huge proportion of their income that is. And I know Dr. Peter Selby at CAMH talking about getting someone with schizophrenia, getting them onto an alternative form of nicotine. And one of the results of that is not just the impact it has on their health, but they start showing up with new shoes. They start showing up better fed. And the idea that, in Canada in 2025, we would have things we call health policies that lead to people not being able to eat properly, not being able to clothe themselves properly, house themselves properly, because we know they're dependent on something that itself has a very high probability of killing them, harming the people around them. We know there's an easy solution to that, and we're not doing anything about it. And I think that, again, the humanism, that how can we be doing this to our fellow man? And you've encountered it with illicit drugs, of the people who can just turn away, pretending this isn't somebody's son or daughter who's going through this. And what do we do to get a dose of humanism into the population, to actually have concern about people like this? And again, to see that it's a big problem. It's a problem that we can very easily solve, and the results would be enormous. And it's not happening because of, little bits of irrational intransigence and a failure to really think through the issue. And sometimes I feel like we're getting there with drugs. We got there with contraceptives. The US is going the other direction now. But I mean, contraceptives used to be illegal because, again, that was immoral, that if you could make contraceptives available, people, they might have sex. And so contraceptives were illegal in Canada and the States until relatively recently, even for married people. And then it was illegal for like single women to be able to access contraceptives. And we look at that now and say, that's just crazy. And the rules we had against interracial relationships in many places in the United States, again, until relatively recently, we managed to change that. The attitudes toward gays, attitudes changed. The attitude toward women being able to work outside the home, it changed. We've seen all these things happening, and I think it gives reason for optimism that we can see this issue changing. And indeed, I think it's worth saying it already is. So it's very much like happened with contraception. You can say it's illegal. You can say you could go to jail if you access these things, and women did. We can just look at family size. In the 1950s, women were getting contraceptives. And now we're seeing the steepest declines we've ever seen in cigarette smoking in many countries, despite governments doing things to protect cigarettes. Despite anti-tobacco groups doing things to protect cigarettes, despite massive misinformation, despite people who are trying to increase taxes on the low-risk products, trying to reduce the accessibility of the products, doing things like saying, let's put pouches somewhere where it's really hard for people to get them, but have cigarettes available in all the variety stores. And we're still seeing these enormous declines, which, again, you talk about in your book. And I think, do you see that as a sign of optimism, or just a feeling that the people that we would cause us to pull out our hair just haven't been successful yet in further restricting access?
Yeah, I think that's we can spend so much time pushing back at politicians and public health and policymakers and NGOs, but they're kind of just pissing in the wind. I mean, so much is happening below the regulations. So, in Canada, what, 50% of cigarettes are now sold illegally, 50% of vaping products. I mean, they've lost total control of this. So it's, in one hand, it's kind of pathetic having all this pushback and wasting all this time with policymakers trying to get them to do the right thing, and meanwhile things are just happening without them knowing it, and or without them even trying to measure it. Mostly, it's happening. It's unfortunately in this situation, it's happening in creating a whole illegal market that didn't need to even happen. So we've made, with prohibition, we've created this monster that's happening, and it's going to be, now it's the struggle is to rein that in. How do we get regulated products? How do we get, you know, things in stores and taxation? Because we've allowed an explosion of the illicit market, and I think that's one of the challenges now, to rein that back in. So it's in everybody's best interest to have regulated products. There's going to be some taxation, but you know, the idea that we're going to, you know, the government's going to make these policies and this is the way it's going to be, that horse has long left the barn. I mean, it's nicotine products, or alternative nicotine is very available in stores or out of stores, and it's just a really unfortunate piece of the puzzle that's kind of gone awry, because we've done such a botched job with our prohibition and our policies, and now we've opened up this whole illegal market. And unlike the cartels who deal with other illegal drugs, the heroines and the cocaines, the impact of this is just so much greater, because so many people are impacted. So it's you know, you might say, you know, people ask me, you know, what are you worrying about cigarettes now? I thought you were doing something serious in drug policy and heroin. But you know, as far as the population impacts and the global impacts, I mean, cigarettes are massive, and the illegal trade is marching right into this, and we've just opened the door for it, and that's a huge you know, unintended consequence of over regulation, or you know, making you know, policies that can't work. So so I do think that a lot of the discussion we're having at the government level and the policy level is somewhat irrelevant to what's really going on in society, and it's really unfortunate we've created a whole secondary problem that never needed to occur if we had have regulated these products appropriately and taxed them to their risk, not the not the appearance of a new product.
Yeah.
Yeah.
Maria, I'm down to only about
47 hours worth of questions.
Sorry, Mark. On mute.
You're on mute, Dave.
All right. Sorry about that. You know, we were talking earlier about how nicotine researchers have said that I would function better if I used nicotine because I'd be able to focus. I just thought I'd give an example. So Maria, we were. I'm very happy to go on. I've got like 12 million additional things I want to talk to Mark about. But there are questions, I think, and you want to open this up for other people to ask anything, make comments, talk about why I'm not smart enough to operate a microphone, that sort of thing.
That's okay. We're just having some technical difficulties. We got to make sure that Mark's muted when the rest of us are talking. I just want to point out we have a few questions, but just in case no one knows how to, where the question is, because I think Teams is a little bit of a newer kind of format that we've used here at Rights for Vapor. So I'm just going to share my screen. Hopefully. So, okay, share this window. So if you look, can you guys all see, can you see my, oh wait, sorry. Oh, see, I don't even know how to use it. Up at the top, if you're using a computer, you'll see something that says open Q&A. So you can open your Q&A and ask questions. Oh, we got a few more questions, just in case people don't know it. And if you're using a phone in your app, at the bottom, you'll see 3 dots. And if you click on those 3 dots, it will come up an option for the Q&A. So we will start with the Q&A, and these are directed to Mark right now. Mark, do you find that objections to vaping and now safer nicotine products for the sake of saving the children an appropriate reaction from the old guard of tobacco control?
No, I mean, as David mentioned, you asked somebody, can you give us a quota, like how many new vapors in kids would you accept to save how many smokers? I mean, nobody can give you that equations, but no, I think we've really been heavily sidetracked with this primary prevention and youth vaping, and that's really been a huge distraction from what we should be doing is trying to get people off cigarettes and all the all the forecast like the gateway thing basically has totally been disproved and the that we're going to have all these kids vaping is totally disproved. I mean, vaping is on the way down. We've made these kind of outrageous worst case scenarios for what would happen with youth vaping, and none of it's come true or will come true. And it's to me, it's been the major deviation for what we should really be focusing on. And I think tobacco control people should be focusing on eliminating cigarettes. That's what they used to focus on, and all of a sudden that doesn't even seem important to them anymore. They really now feel that I think the NGOs can raise more money if they look like they're trying to protect children. The politicians can get more votes if they look like they're standing up for kids. I mean, so it's really a political and a funding bonanza to focus on youth vaping, and that's what's happened at the expense of promoting and giving clear information for people who could benefit from alternative nicotine.
You could mute. We have a question from Matthew, which goes along with another question with Ashley B that talks about the best way to get the word out to the government when we want to spread the message of harm reduction and evidence-based policy. But Matthew goes a little bit deeper, could you help us equip the average vaping advocate with enough research-based information, data, and arguments to have a conversation with their locally elected officials in order to help convince the policymakers that they have it backwards? If the entire consumer base is loud enough and voicing themselves frequently enough and have the conversation with them convincingly enough, could it make a difference? He's in Quebec, and Quebec has some of the worst laws around vaping. I will tell you, Matthew, you do have, I can forget what the vaping coalition out there with Valerie, and Quebec is very, very unique. And anything that we have done in Quebec personally as Rights for Vapors videos that we've done, they've really manipulated the black market and ignore it. And I think this is just mine, and then we'll get Mark to answer. But right now in Quebec, they are tobacco control has the louder voice, and that's from one woman. You guys need to keep fighting that woman's voice. Keep doing it, and it doesn't matter if it's one woman's voice. All you need is one loud enough French voice to counter it, or three of them. Just remember, you're fighting against a singular person. But Mark, you carry.
Yeah, I think the third webinar we're going to talk about human rights and community activism and things, but certainly a strong message, from me and in my book is that the community has a huge role to play in this, and I think because of the stigma of cigarettes and the stigma of vaping, and it's very hard for people to put themselves out there because there is stigma attached to this, and people like Maria and others are exceptions to the fact. But so many people even have experienced the benefits of stopping cigarettes and now vape are embarrassed about their vaping. Even like some people are more secretive about their vaping than they were about their cigarette use because there's just so much misunderstanding and in society. So we need to really try to continue to fight that stigma and give community people the voice. And I think that, it would be pretty hard I'm sure that Maria's had pushback, but somebody like Maria talking about her experience, and many other people who have, turned to vaping, it's pretty, what's a person supposed to say? Like, I feel better. It saved my life. I'm not sucking in all these chemicals. Like, it's just so obvious that people have the right to do that and should be in a position where they can freely do it and access this freely and not receive the stigmas. But I do think that the voices of the community and consumers is extremely important. And all my experience with other harm reduction and with other substance use has really been community driven. And it's extremely important to do that, because I don't think that people at my in my sphere, my public health colleagues and politicians that I talk to, they're probably not going to change their minds based on what they hear from me. I mean, they're so entrenched, and it's so unfortunate that this has gone so deep that it's very unlikely somebody who's come out strongly against vaping or safer nicotine is all of a sudden going to tell you, oh, I was wrong. You were right all along. I'm sorry, I made a mistake. I don't think people work that way. And it's very frustrating, but it really needs to have a total new line of attack. And I think that can be led by, some of us who are willing to be leaders in public health, but really the community voice is extremely important. And to try and organize that it would be extremely helpful. I think there is quite a bit of information out there as far as, point by point, what your advocacy could be saying, but I can talk to Maria, but that could easily be put together a package if that would be helpful. But there's certainly lots of great information out there and different websites.
Can I compliment?
Yep, go ahead, David.
I can just rudely interrupt. Back in the 80s, when we were involved in campaigns of the Non-Smokers' Rights Association to do things like get smoke-free workplaces, this question came up all the time. What can I do? I have people telling me that, I have no right to a workplace that doesn't make me sick, that there's, and, where do I get information? So we hired a journalist, Martin Dewey, who wrote a book about getting a smoke-free workplace, all the information you need so that people could read that book, become quite knowledgeable, and then be able to use that information when they were talking to people that in a position of power where they're trying to get their right to a smoke-free workplace. So I'd recommend that, maybe what we should look at is we could maybe find somebody who could write a book about vaping and give people lots of good information, and they could get the book and they become knowledgeable. And my gosh, you're right. Somebody did it. And I highly recommend it. Getting the information is so valuable. Being able to respond. I mean, Mark does a great job of pointing out so many of the fallacies that are involved here, pointing out the history of how other things have progressed, and making your case. And as Mark so well knows, the history of so many of these issues of achieving rights, they're not handed to people. People have to get them. Nobody ever came along and said, hey, we got this great idea. We should give the vote to women. We should stop discrimination against people on the basis of their race. We should stop discriminating against people on the basis of their sexual orientation. We should stop, people fought for it. They had to have the information. They had to start making the arguments and speaking out. And we're seeing that among vapors. And this book just gives you the ammunition necessary to do that. So, encourage people to get it, to read it, to talk about it, and use that to an advantage. I mean, information's power.
Absolutely. Thank you. And I'm just going to say this from a personal perspective. And Matthew, I was you. I no longer own a shop. Can we just let the aunties know that? Because they keep quoting me as someone who owns a shop. It's patience and persistence and learning. Just keep knocking on those doors. Keep learning. Be confident in the knowledge that you know. And you can always reach out to us at Rights for Vapors. And also, I'm going to do a little shameless plug because these two guys will be at the conference. We have the Safer Nicotine Summit happening November 13th and 14th in Ottawa. It is a good place to start your learning. There will be information being sent out from the CVA to shop owners. If you are a consumer, it is free to come. but that is a good place as well. But just be patient and persistent, and remember, you're fighting a singular person. Her name is Florie Ducas in the province of Quebec. Do not give that woman more power than she deserves. But anyways, that being said, one of the biggest and hottest little things that just got popped into our laps this last night is the BC government's new proposed vaping legislation, which aims to have vaping companies pay for health costs. Like, what is everyone? A couple of people have emailed me questions. Jackie, can you email me your question? I see your hands up. What is behind this law? What are your feelings about it? Like, we know that they're trying to up from the tobacco law and the drug law, the drug cases and stuff like that. Like, is this a cash grab? Like, what are they trying to do? And how would this end up affecting access for consumers at the end?
Yeah, I mean, I did a quick radio interview about this, and the only information I had was from what I read in the CBC article online, and somebody did send me the actual legislation, and I got through the first couple pages. It's just legalese nonsense, basically. So I can't see anything but a political. It's all politics. Like, this is some topic that the government just wants to continue to make it look like they're being tough on drugs and tough on tobacco companies, and why not try and get some money out of them while they're at it? But it's just, really based on disinformation and fear. And the one thing that it said in the news article that I think the government, the general, whatever, attorney general was asked about where the money would go, and she even said it would go straight into the general coffers. Like, there was no even pretend that it had anything to do with protecting people's health or try to strengthen public health. So yeah, it just seems like a bizarre. I don't understand the timing. I don't know why the NDP government thinks this is a good idea, but like all kinds of prohibition around any kind of substances, I mean, it's a political win. Like, I'm sure that, oh, good, they're being tough on vaping companies. And the other really difficult thing, and I mentioned it in my opening comments, as far as who's selling this stuff. And it really causes me a lot of grief also, because if I have anything to do with tobacco companies, then I'm sort of blacklisted as a cop out and a sellout, which I find a bit gulling after my whole career. I'm not doing this because I'm trying to help tobacco companies. I mean, but it's very difficult. If there should be anybody paying for the transition away from cigarettes, it should be tobacco companies, because they have all the profits and the money. So I think that only makes sense that they should be paying for the promotion of safer products. But this legislation, I don't know. I don't have any idea where it came from, even though I live in BC. And but I think it's a political maneuver, and it's a cash grab, I guess. They can just feel they can take money from vaping. I don't really understand. So, because there's really we have no data to show that there's any ill health effects from vaping at all. So I'm not sure where they're calculating how they'd actually make money from this.
David, any thoughts?
It's bizarre. I think it shows the naivety of the government. So tobacco companies were sued because of all the damage done by cigarettes and the fact they'd misled people. And work that I did back in the 80s and 90s to hold them accountable, to show them how poorly informed consumers were, and their obligation to warn people about the nature and extent of the hazards inherent in the use of their product. And they weren't doing that. And the losses are measured in many hundreds of thousands of lives. It's measured in many billions of dollars. And justifiably, there was to be compensation for that, and that's what's happened. But this is, a lot like saying that we caught somebody who burnt down several buildings, a real arsonist, but fortunately he had resources. So, we've taken him to court and we've forced him to pay damages for the buildings he's burnt down. And well, that was so lucrative, we decided to charge some other people with arson who've never burnt down any buildings to see what we can get from them. I mean, that doesn't get you anywhere. And if the governments were ever serious on this, the strongest case ever against cigarette companies in tort law is that they are selling an unreasonably hazardous product. And cigarettes are shown to be unreasonably hazardous because there's products that will give people what they're getting from their cigarettes at a tiny fraction of the risk. And that means as a manufacturer, you have an obligation to move people to those lower risk products, to tell them about it, to use marketing to move people as rapidly as possible to those low risk products. But they've been protected, and they were protected because it was anti-tobacco groups and governments that said, let's make it illegal for companies who are selling these products to tell people about the difference in risk. Well, there's your get out of court free card. When I was working on this stuff early this century, on the example from Sweden of snus, I mean, Swedish Match, owned at the time by an entity controlled by a social democratic Nordic country, said, it looks like our cigarettes are killing a lot of fellow Swedes, just like Volvo was saying, it looks like our cars are killing fellow Swedes. What can we do? And in both cases, they said, let's be pragmatic and look at how we can reduce risk. And they both did. Sweden, or the Volvo, moving to many areas of auto safety that changed automobiles around the world. Swedish Match looking at how do we move people to an oral form of tobacco, and eventually got totally out of the cigarette market. And Big Tobacco could have done that. And instead, they engaged in a PR effort to mislead people about their cigarettes, keep selling cigarettes, and kill millions and millions of people. That is a phenomenal court case to be able to say, you had a choice. You chose to kill in order to make more money. I mean, what a terrific case. Except that our whole basis for that was undermined by people who call themselves anti-smoking, who claim that there's absolutely no difference in risk between smokeless products and cigarettes. The U.S. Surgeon General said that to a congressional committee I was also testifying in front of in 2003. You know, let me assure you, regardless of what you hear today, there is no evidence that any smokeless tobacco product is less hazardous than a cigarette. And, you know, there's no sense holding back in this. He lied. He lied to Congress, and he was congratulated by health groups. And this is just after Altria had said, from now on, we defer to health authorities on the health effects of smoking. They were off the hook. It was done by health groups, so-called health groups. There's a long history. So if British Columbia or any other government were serious about getting compensation, about holding cigarette companies responsible, they've done a lousy job of it. You know, they ran in the coattails of something that just got them a bunch of money, but we still have so many people dying from cigarette smoking. So few of them have any understanding of the magnitude of the difference in risk between their cigarettes and non-combustible products. And they're not being told. You know, governments are committing what in tort law we would call deception by omission. You know people are misinformed. You know they are suffering and dying because of that misinformation. You have an obligation to inform these people. That is your mandate to improve the health of the public. And you're not doing it. You know, so there's lots of cases that would be very interested to see going to court, including suing NGOs that are misleading the public. But I just don't see any basis to say we're going to go after vaping companies for the harm they're doing. They're a net positive. So maybe British Columbia has to start paying money to the vaping companies because of all the money they're saving by people not getting sick from smoking.
Okay. We do have two consumers on the line that wanted to ask questions. I think it's Jackie and Marion. We're going to go a little bit over. So if you guys want to stick around for 10 minutes, is that okay with you guys? Because I'd really like Marion and Jackie to ask their questions. So Marion, I'm going to unmute your microphone. And if you want to ask the question, and then just mute your microphone again. Okay, you're unmuted, I think. Marion, can you hear us? Okay, this is not working. I'm sorry, guys, we're going to fix this for the second one. I am so sorry because I don't think anybody was able to figure out where the questions were. I'm very sorry about this. We are just learning this software. We thought we had it done, but we're not able to unmute people to ask the questions. And I'm very sorry. I want to say thank you. I guess we're going to wrap it up right now. I want to say thank you to Mark, Dr. Tyndall, for doing this webinar. Education equals empowerment, and empowerment helps you engage better. The more we learn, the more we're able to. Thank you, David, for moderating this one. This first one, it was always great. I have had the privilege, and I'm so grateful to be able to speak about this topic from a more user perspective around the world. And one of the things when I talk to advocates from all over the place is how lucky we are to have people like Dr. Tyndall and Professor Sweener in our world, and how amazing you guys are and how active you are in the community. So thank you for me. And it's just like a little bit of, Canadian THR pride on there, but we are blessed. We have some incredible people. And also I'm going to push, if you're in Toronto, Dr. Tyndall, what is the date? Mark?
You can tell me.
November 22nd.
22nd. Okay.
Yeah, we're in Toronto on the 22nd. You can go on the Rights for Vapors website. It is a free event. CVA, thank you, Sam, will be providing some beverages. You can buy a book there if you have a book. Bring it with you. Also, November 12th and 13th, the event is free for consumers. It is not free for others, but we're having an incredible lineup of speakers. We have some new Canadian voices. Sean Fisk, who is with, I forget what he is, but he did this whole project on tobacco harm reduction and talking about compassionate care for people who smoke. So that's a really new perspective to add. And also a pharmacist by the name of Todd that is out in Alberta, who does promote tobacco harm reduction and promotes safer nicotine products. So it's going to be a great day. And then obviously we have Dr. Tyndall and we have Professor Sweener. So it's going to be absolutely wonderful. And all that information is on the Rights for Vapors site. You will get a link to register to the second one, and we'll be a little bit better with this Q&A. I promise you. I think that's it. Thank you, everybody.
Great. Thank you.
And
Yeah.
By the
Buy
way,
a book. Yeah. Okay.
thanks everyone.
Thanks, David. Thanks, Maria.